So now here at 5 o'clock, the death of a Needham mother is sparking new fears tonight about this year's flu. A GoFundMe page says that 51-year-old Jenny Ching was admitted to the hospital last week, diagnosed with the flu, then developed into pneumonia. A lot of people are wondering how this could happen, how you can protect yourself. Dr. Mallika Marshall is here with us tonight. And doctor, for a relatively young, otherwise healthy mother of two to actually die from the flu, this is so frightening for so many people.
I know, this has shaken a lot of people, right? Well, you know, when we talk about who's most vulnerable to the flu, we talk about the elderly, we talk about young kids and infants, pregnant women, people with underlying conditions like asthma and heart disease. But unfortunately, otherwise healthy adults and kids can sometimes get really sick from the flu and actually die, which is why we stress how important it is to get vaccinated every single year, not only to protect yourself, but also to protect the people around you. And that's even if we don't think that that particular flu vaccine is particularly effective.
We were just talking to people on Facebook Live about this. Several people said that they're in bed right now with the flu. So what do you look for as an indicator that you don't just have the average case of the flu, that it's something more serious, that maybe you need to see a doctor?
So typical symptoms of the flu are high fever, headache, body aches, cough. You feel awful. Yeah. But if you are able to manage your symptoms with fever reducers and pain reducers and you can stay well hydrated, you're probably going to do just fine. Most people who die from the flu die from pneumonia, either from the influenza virus itself or from a bacterial infection that can develop on top of the flu. So if you develop shortness of breath, your cough is getting worse, you have bad chest pain, you can't keep fluids down, you need to call your doctor or you need to get to an emergency room.
So it sounds like once it's in the lungs and the chest, that's a big indicator, right?
Exactly.
Are there medications, a lot of people will ask, to treat the flu when you have it, or is this the type of thing you have to ride it out?
Okay, so antibiotics don't work, but we do have antiviral medications that we can treat people with that can shorten the course of the illness by about a day and can reduce the risk of complications. We tend to reserve those medications for pregnant women, people who are at high risk of complication, people with asthma, diabetes, other underlying medical conditions. But if you fall into one of those categories, you think you have the flu, call your doctor and call soon because you need to take it within the first few days of symptoms.
And even though the flu shot hasn't been all that effective this year, you're saying still go get it?
Still go get it. If you haven't gotten it, it's still not too late. We haven't seen the worst of it yet.
I got mine.
Good.
Because I listen to you.
Me too.
All right. Dr. Mallika, thank you so much. Lisa.